Welcome to Community Health Matters. I'm your host, Kristen Presall. On our show today, Dr. Michael Warren joins us from the Tennessee Department of Health to talk about the importance of carrying your baby to full term and why healthy babies are worth the wait. Pediatric endocrinologist Dr. Deanna Aftab Guy joins us to talk about diabetes, its prevalence here in Tennessee, and tips for identifying and managing the disease in adults and children. Hunger impacts the lives of 1 in 6 Americans, and 1 in 4 children struggle with hunger every day right here in Tennessee. Miss Jaynee Day of Second Harvest Food Bank joins us to talk about the problem of hunger and how Second Harvest is working to solve hunger issues in Tennessee. All of that coming up next on Community Health Matters. Did you know preterm delivery is the most frequent cause of infant mortality, accounting for more than 1/3 of all infant deaths in the first year of life? Preterm birth is when a baby is born before 37 complete weeks of pregnancy. And in addition to the physical and emotional impact of preterm births, the Institutes of Medicine suggest at least $26 billion is spent each year for hospitalization of preterm infants. To help give your baby a healthy start in life, see your doctor regularly, stay healthy during your pregnancy, and try to avoid delivery before 39 complete weeks of pregnancy. We want to welcome to the program Dr. Michael Warren with the Tennessee Department of Health. Thank you so much for your time today.
Absolutely. Thanks for having us.
Sure. It's a pleasure to visit with you. We're talking today about preterm birth. And if you can, give us the medical definition, Dr. Warren, please.
So when we talk about a baby who's born preterm, we typically mean one who's born before 37 weeks of gestation. So pregnancy, typically we think about being 40 weeks. People tend to think 9 months. It's really closer to 10 months, 40 full weeks. And so if you're born before 37 weeks, that classifies you as a preterm birth.
All right. You always usually hear from your doctor how important those last weeks are for the baby's development. Specifically talk about how the baby develops in those last weeks.
Absolutely. So we know that if you look at a baby who's born at 35 weeks compared to a baby who's born, say, at 39 to 40 weeks, their brain at 35 weeks is only about 2/3 the size of what it will be at 40 weeks. You think, well, it's only 5 weeks, but that's a massive amount of brain growth.
Sure.
And if you think about the job of little babies in those first few weeks and months, they need to be able to eat and sleep and regulate their breathing, and that brain development really helps allow them to do that on their own. And so those last few weeks are absolutely critical to be able to do those very basic things that babies need to be able to do.
Sure. What would you say are the biggest risks for a baby who is born preterm?
So related to the things we just talked about, many times they don't feed very well, and a lot of this has to do with how preterm they are. So if a baby is born, let's say 28, 29 weeks, they're going to have more possibility for severe complications or more severe complications than, say, a baby who's born at 34, 35 weeks, although even those 34, 35 week babies can have complications, but things like difficulty feeding. So sometimes we have to feed those babies through an IV or even a special feeding tube. If they're born very premature, they may have difficulty breathing. So sometimes those babies are on ventilators to help them breathe for those first few weeks of life. And so those are the main kinds of complications that we see. There are others. Sometimes babies come preterm for a reason. Perhaps mom has a medical problem or baby has a medical problem. And so if that's what prompted that preterm birth, then there may be other issues associated with that, say congenital heart disease or a lung disease.
All right. Well, usually all of our focus is on this new amazing life, but right. There is risk for moms too when we're talking about preterm birth, correct?
Absolutely. So sometimes a medical condition that mom has may be what prompts the baby to be born preterm. So maybe mom has an underlying chronic disease that contributes to that baby being born preterm, and so there may be medical complications. I think one thing we tend to overlook sometimes is the emotional and psychological toll that preterm birth takes on the family. And so we're focused on caring for this little baby, and yet Absolutely. We've got a mom and a dad or a partner who are, preparing for this healthy baby who's now maybe in the intensive care unit. And so when we think about complications for the family, we really need to think broadly about what's the impact of that baby being in the NICU. And folks always expect that perfect baby and that absolutely healthy baby, and when things don't exactly turn out like that in the beginning, it can be pretty traumatic for families.
Sure. No matter if the mom has a predisposed medical condition or whatever the situation is, because I know each pregnancy is different, are there general warning signs that all women should be paying attention to that signify a preterm birth or likely preterm birth?
Sure. So one of the things we know is as women get closer to delivering, many times they'll start to feel contractions or feel pressure.
Sure.
If women feel those signs early on during pregnancy, those should be red flags. If they have vaginal bleeding during pregnancy, that would be a red flag as well. This sort of vague sense of pressure they may feel in their abdomen or their lower stomach, those would be signs that would be concerning as well. So I think one of the things we always like to tell parents and individuals in general, you know your body the best. If something doesn't feel right, call for help. And just, it may mean calling your doctor's office and saying, here are the symptoms I'm having, should I be worried? And never feel bad about doing that.
Sure. Dr. Warren, just so folks have a really good idea as what we're dealing with here in the state level for preterm birth, what are the statistics?
So we have, in general, about 80,000 births a year in Tennessee.
Okay.
And about 11% of those, or just under 9,000, are born premature. So those are, again, those babies born at less than 37 weeks. So about 1 in 10, 1 in 11 babies. And what that means is if you visit hospitals across the state, we've got preterm babies in most of those NICUs who may be there for a few weeks. Some of them may be very sick and may be there even for a few months till they're ready to go home.
Okay, in recent years we've heard the term of elective deliveries. Can you kind of explain what that is?
Sure. So as we've gotten better from a medical standpoint about being able to take care of these very small babies, years ago folks would say if a baby was born before 27, 28 weeks, the chance of survival was very low. Now that number is back closer to 24 weeks. And so sometimes we think because we can provide all this great medical care that it's okay if the baby comes a few weeks early. And so what we see happen sometimes is you may have a provider who, for whatever scheduling reason, says, we're going to go ahead and schedule this delivery earlier. Maybe you have a family who says, dad is going to be deployed or family is going to be visiting from another state. We really want the baby to come this week. And that's convenient, but what we forget is those last few weeks are so incredibly important. And so if we cut those off and bring that baby into the world, we can deliver the baby and care for them, but it's not without complications.
I was just going to say, personally speaking, my doctor did not allow that at all. It was just like the baby's going to come, whether I deliver or someone else does.
Right.
We can't have a perfect scenario. So I guess give us the main reason of why it's not a good idea to try to do something like that, to have that elective delivery.
Sure. So babies will generally come when they're ready, and they let mom know when they're ready to come, and you sort of have this normal physiologic process. When you alter that process, you may have to induce labor in the mom. That doesn't always go well, so you try to induce a vaginal delivery, but sometimes that doesn't work and you have to convert to a cesarean section. So now you've got a mom who was anticipating a natural delivery who's now having a surgical procedure. So that's a procedure that didn't need to happen. But again, it also gets back to that baby really isn't ready from a physiologic standpoint to be born, and so they're going to need some additional support, whether that's from a feeding or breathing standpoint.
All right, Dr. Warren, you have traveled the state extensively and obviously have educated other doctors, talking to them about trying to reduce preterm birth here in our state. What has the response been like from educators and physicians alike, and how trying to reduce that number?
There's really been a tremendous response across the state. So our department has partnered with the March of Dimes, the Tennessee Hospital Association, the Tennessee Perinatal Quality Care Collaborative, and worked with all of those folks to say, let's try to reduce those early elective deliveries. Now, if a baby is coming early because of a medical problem, either in the baby or mom, those are going to happen. We're not trying to stop those, but those elective deliveries. And so many hospitals have instituted what are called hard stop policies, meaning if an obstetrician tries to schedule an elective delivery or induction prior to 39 weeks, the folks in that hospital are empowered to say, maybe we shouldn't do that. Maybe we should make sure there's a medical reason before we do that. So that's one side. There's been a lot of effort too with consumers to say, how do we make sure folks know that truly we should wait till 39 weeks because a healthy baby is truly worth the wait.
You touched on this a little bit earlier, but kind of go over some of the medical complications a woman might face, pre-existing conditions they may have, that will definitely send them along that path for preterm birth.
So one of the most common things that we see in Tennessee is tobacco use. We know in general about a quarter of our adult population smokes. What's surprising to a lot of folks is that 16% of women smoke during pregnancy, and smoking during pregnancy is absolutely a known risk factor for preterm birth and low birth weight delivery. So that's the most common. Other chronic diseases, diabetes, high blood pressure, conditions like that may also predispose that mom to a premature birth or other complications.
So many important things really to think about.
Absolutely.
Obviously, when you're even talking about conception and then when you're actually pregnant. So obviously consult with your doctor on all of these kind of things.
Absolutely. And our key take-home message is let's focus on being healthy before you ever become pregnant. You can't correct lots of health problems in 9 months. So if you're healthy when you get pregnant, that's the best solution.
Dr. Michael Warren, thank you so much for your time today.
Thank you.
Did you know that proper diabetes management can help prevent or delay complications from the disease? Studies show that keeping blood glucose, blood pressure, and even cholesterol levels close to normal can help prevent or delay problems like damage to the eyes, heart, blood vessels, nervous system, teeth and gums, feet and skin, and even kidneys. To learn more about living with diabetes, talk with your doctor or visit diabetes.org. Visiting with us now is Deanna Aftab Guy, Dr. Guy, I should say, who is a pediatric endocrinologist and also the medical director for clinical services at United Healthcare. So nice to meet you and visit with you today.
Thank you. It's great to be here.
Let me start off this conversation just by saying that I understand, and these are big statistics, everyone, but 30 million Americans actually today have diabetes, but only 1/3 of those people know that they actually have diabetes. So this is a really important program for so many people to make them aware of exactly what it is. If you can define diabetes for everyone, please.
So diabetes is a state of health in which your blood sugar is higher than normal. And that's just a simple way to describe it.
Just that feeling of like, I need food. I mean, is that similar to what we're talking about? Because people have that all the time, but you shouldn't be concerned with just that, obviously.
Now, they tend to have other symptoms, and it's gradual. It doesn't just turn on in one day. So they may feel not themselves. And as the blood sugar rises, they may not feel like they have enough energy. They may be losing weight. They may have a rapid gain in weight. They could be urinating more, feeling nauseated, frequently sick. And a lot of the symptoms don't necessarily tell you diabetes when you think about them.
All right, there's type 1 diabetes and then there's type 2 diabetes. Can you kind of talk about those and tell us what the difference is?
Yes. Type 1 diabetes we used to think of only occurring in children.
Okay.
Type 2 diabetes we would tend to think of our grandparents, adults, older folks. Well, each of them now is crossing over into the age groups. Oh. And you can see type 1 diabetes in adults, and you can see type 2 diabetes in younger and younger children, adolescents. So it's not necessarily age restricted. Type 1 diabetes is due to when our body does not make insulin any longer. Insulin is the hormone that our body makes that helps us manage our blood sugar. It's made by the pancreas. It's the only hormone we have to help us lower our blood sugar. So you can imagine without it, we would be in a lot of trouble.
Yes.
And our blood sugar would rise and not get into the cells where it needs to go for energy. Type 2 diabetes also results in an elevated blood sugar, but it's because we don't make enough insulin. So it's there, but it might not be working for our body's needs. We tend to look at those patients as being resistant to the effects of the hormone. It could be a combination of their genetics and being overweight, where the body's needs have now changed and the insulin can't work like it used to.
I mentioned how many folks are diagnosed with diabetes here in America, but tell the viewers why they should be concerned with diabetes in general.
Well, diabetes itself makes you prone towards other health problems. Coronary artery disease, clogged arteries, heart attacks, things that are related with that, and strokes. If you have diabetes, you have a 3-time risk of having coronary artery disease and strokes compared to someone who does not have diabetes. And that's frightening.
Absolutely.
The other thing is high blood pressure. It sounds so simple, but if you have diabetes, you have a 1.5-time increased risk of having high blood pressure if you have diabetes. So these are three important things: heart disease, stroke, and high blood pressure, which can lead to other problems down the road.
Dr. Guy, you mentioned some of the symptoms that you would, have to sit there and evaluate yourself if you were having some of these things, to talk with your doctor, is this diabetes? Can I get tested for this? But let's talk about some of the risk factors, if you can break those down for viewers as well.
True. So there are some things we can't control, and that's our genes. So it's very good to know your family history so that you can watch your health well with your doctor in order to decide if you're at risk for diabetes and to watch to see if you're developing it and to maybe prevent it. The other things that we can control are the factors sort of outside our body, our lifestyle. And a sedentary lifestyle in which we are not exercising and moving our body as we should can contribute to a risk of type 2 diabetes. Also obesity, which is interlinked with a sedentary lifestyle, and our diet. And if you already have the genetic tendency to have diabetes, particularly type 2 diabetes, which is linked with obesity and sedentary lifestyle, you probably need to be more careful and attentive to these areas and work with your doctor to prevent them from occurring.
You mentioned that type 1 diabetes and type 2 diabetes are now being diagnosed in both adults and children and kind of overlapping each other. You specialize in pediatric diabetes. So explain the difference of how a younger person would deal with diabetes than an adult.
True. Well, when you have a child, you also have their parent or their caretaker and their family and their school and their babysitter and their grandma. So you're working with a team, even though adults should have a team too. So you bring a child with newly diagnosed diabetes, they're frightened. Sometimes they can't even speak for themselves. You can have type 1 diabetes as young as in the newborn age. So it's very important to teach not just the child once they're able, but also the parents what's important to take care of their diabetes. Checking blood sugars, letting others know when they're not feeling well, keeping their doctor's appointments, taking their medicine, insulin, when they need to, and monitoring their illnesses around their diabetes.
All right, getting that help for the child is obviously essential. But as you said, you feel like the adult should almost have a team. When you are diagnosed with diabetes, how do you, as an adult, manage it? I mean, because there's a lot of steps that you have to take to be able to keep it in control.
There are. I think arming yourself with a good physician and keeping in contact with them is critical. Not just your primary care physician, you should probably also have a diabetes specialist working with your primary care physician. A nutritionist is helpful, and often they're based at your doctor's office, or sometimes your doctor can refer you to one. A foot doctor to help check your feet periodically because there can be complications. And then having your doctor direct you to specialists that are needed depending on where your health goes around your diabetes.
All right. Diabetes is obviously prevalent here in Tennessee and in other states. Do we know why?
This is considered the diabetes belt, and there are about 15 states in which diabetes is much more prevalent compared to other parts of the country. It's felt that 8 in 100 adults in the state of Tennessee have diabetes, compared to probably about 5% in other states that are not in that belt. The most common thing in those states, including Tennessee, is a sedentary lifestyle and obesity.
All right. Let's talk about if there is a cure for this condition.
That's something we strive for every day. And parents of children with type 1 diabetes know this to heart. Adults don't realize, but the research is geared towards it. There's no cure for type 1 diabetes yet, but I bet there will be, and I know they're coming closer. Type 2 diabetes can improve to the point where you won't need medication anymore. So in a way, it's treated and improved significantly. It may always be there, and you may always be at risk for it. Type 1 diabetes is not curable yet, but is very treatable, and children and adults with type 1 diabetes can live a very, very healthy lifestyle with the treatment that is available right now.
And also very important to point out is prevention, obviously. You know, you mentioned a couple things, but can you tell folks the most important thing to keep in mind when thinking about preventing diabetes in your family?
Oh yeah, well, knowing your family history, having a primary care physician, and knowing your risks, weighing yourself and understanding your weight and your lifestyle with your doctor, and compare that to your health and what's healthy for you to start doing. Do you need to involve exercise, change your diet, quit smoking, control your blood pressure, things that you can control, your cholesterol.
All right. Dr. Guy, thank you for your time today.
Thank
Great
you.
information.
Thanks.
Did you know that 1 in 6 adults and 1 in 4 children struggle with hunger every day in Tennessee? Programs like Second Harvest Food Bank and its more than 450 nonprofit and corporate partners are committed to feeding hungry people and working to solve hunger issues in our community. If you know someone who needs emergency food assistance, contact Second Harvest at 615-329-3491 or dial 211 for assistance. We'd like to welcome Ms. Jaynee Day, President and CEO of Second Harvest Food Bank, to the program. So nice to see you.
It's good to see you as well.
And great to visit with you. I know that you all constantly stay busy over at Second Harvest and do such a tremendous job for the community, so thank you for that. I will start off, though, for folks who might be new to the area or people who are not as familiar with Second Harvest, give us an idea about the organization. Tell us a little bit about it.
Well, Second Harvest is a nonprofit organization whose mission is to feed hungry people and solve hunger issues in our community. We've been around since 1978, and we actually cover 46 counties in Middle and West Tennessee. So we're not just here in the Nashville area, but we're throughout some very rural counties that have some huge needs.
We wouldn't think that hunger is still such a big issue, but it is, and not just nationally, here in the state of Tennessee. Specifically, if you can talk, Ms. Day, about Middle Tennessee and West Tennessee in which you work.
Right. Well, 1 in 6 Tennesseans and 1 in 4 children in Tennessee are at risk of being hungry every single day. Now, what that means is that they don't know where their next meal may come from. It's a very staggering figure. It is one that I never thought would be that high. But hunger is, and people think sometimes it's in certain pockets in certain neighborhoods, but really hunger could be your next door neighbor. It could be the person that you sit next to in the church pew. It could be one of the children that your child plays with at school. Hunger is very much alive in this country, but it is a problem that we can solve if we all work together.
Something I think that's so special about Second Harvest are the programs that you all have implemented over there, and several, throughout the years. You have a lot of different ones in particular. I'd love for you to tell us about some of, not that you have any favorites, I'm sure they're all favorites of yours, but tell us a little bit about, like, the mobile pantry, for example.
Okay, exactly. Well, we actually partner with over 450 nonprofit agencies, and what that means is they are have a food component as part of their program, and we solicit the food from the food industry, and then we redistribute that food back out to help them feed their clients. Could be a school pantry, could be a low-income daycare center, could be a senior citizen center. All of those organizations qualify. The mobile pantry is probably one of my favorite programs. I love them all, but that probably has to be one of my favorite because you really have direct contact with clients directly. And we take out about 15,000 pounds of food on one of our trucks. We work with a local agency or church group in that community that has identified a need for families that need groceries for a certain amount of time. They then qualify those candidates and those clients, and then they arrange for us to bring the food out. It will be comprised of non-perishable food items as well as perishable food items, because we're very concerned about the nutrition of our community and how people are eating, and we hope that they'll be eating better and healthier because that makes for a stronger community.
Absolutely. You also have the backpack program.
Yes,
we were talking about a little bit about this right before this program started.
We actually were one of the first 5 food banks in the country to start that backpack program. And it's for children who are at risk of hunger. Teachers will put a supply of food that we have packaged at the food bank. It's all non-perishable food items, provides about 3 to 5 meals over the weekend that they can consume. It'll have a shelf-stable milk and a shelf-stable juice and fruit and canned meat and those kind of things, all pop tops, so the kids could open them easily if they needed to. But teachers identified this as a huge issue because they were seeing children come back on Monday and not able to concentrate, not able to learn, had a lot of disciplinary problems, a lot of health issues. And so they actually came to food banks all across the country and said, can you help us? Wow. We think part of the issue is these kids are food insecure, and we know if they have food and it's good and it's nutritious, they can learn. So we're very closely tied to the educational success of all of our communities because food is such a huge component of that.
Absolutely. And I would like to talk a little bit about here in just a moment about the food insecurity, but let's talk about how you determine the types of programs in which you end up coming up with for the organization itself.
Sometimes they're driven by the community needs in that community. You know, we have a lot of seniors and we have a lot of children that are very vulnerable, and so we want to create the kinds of programs that they can benefit from. But then we also know that we have a lot of clients that are limited on their transportation, so we want to make sure we're getting the food to them or getting it centrally located where they can access the food and it's not too much of a hardship. When you're hungry, you have a lot of issues, not just about being hungry, but you know, sometimes people come to us and they say, I have a high utility bill this month. You know, they're trying to stay warm in the winter or cool in the summer. So I've had to expend what expendable income I have on those bills, and I don't have enough to eat 3 meals a day. Wow. So that's why people come to us, or perhaps they're a senior citizen and they need, they've spent all their money on prescriptions, and we know you can't get better if you're having to make a choice of, do I take my medicine or do I take, or get my food?
Yeah. You know what, you're really changing lives, helping improve lives on so many levels, but can you break it down and kind of quantify the impact that you're making in terms of pounds of food in which you're able to distribute? Absolutely.
So in the very first year that Second Harvest was created, we distributed about 168,000 pounds of food. Last year, we distributed over 27 million pounds of food. 10 million pounds of that food was perishable food and produce, which is healthy and nutritious for our community. So you can see how great we have grown over the last couple of years. Also, we've seen a high, in the last 6 months, we've seen our poverty numbers increase by about 5%. So we have more families living in our service area that are needing our services now more than ever.
All right. Ms. Day, what other issues or problems contribute to food insecurity, as you just spoke of a little bit ago?
Sometimes it's utility bills, sometimes it's medical bills, it's underemployment, where after the recession, a lot of people did go back to work, but they're working at a lower salary than what they previously were working at. They still have to feed their family of 4, they still have to put gas in their car, they still have to get to work every day, and they still have to put food on their tables, and it's making it a little bit more difficult. So food prices have also gone up in the last couple of years by about 35%, and that's having a huge impact on families being able to feed their families.
All right. If somebody needs personal assistance, how can they be helped by Second Harvest?
They can go to our website, secondharvestmidtn.org, and there's a lot of different information on there where they can go in their own community, whether it's in the city of Nashville or outside Nashville. They can also call us at 329-3491. We'll be happy to answer any questions that they may have. People can do food drives if they want to help their neighbors. They can donate money, or they can donate their time and come and volunteer.
I was just going to say, you have corporate partnerships that you have had for many years. You have an excellent team of employees, but you also need the community's help in terms of volunteering.
Absolutely, absolutely. Can't do it without the community. It's all about the community.
All right. Well, President and CEO of Second Harvest Food Bank, Ms. Jaynee Day, it's so nice to visit with you.
It's nice to be with you.
Congratulations on all the success you all have had.
Thank you.
Thank you for your time. And thank you all for tuning in. We'll see you next time.